Hello, my name is Sunseok Jo, and my student number is 3219-4417. And today, I'm going to talk about tooth whitening. First, we have to know the basics about tooth whitening. The process of tooth whitening lightens the color of a tooth. Tooth whitening can be achieved by either changing the intrinsic color or by removing and controlling the formation of extrinsic stains. The chemical degradation of the chromogenes within or on the tooth is termed as bleaching. Hydrogen peroxide is the active ingredient most commonly used in whitening product and is delivered as either hydrogen peroxide or carbamide peroxide. The time, exposure, and concentration of the bleaching compound determines the tooth whitening endpoint. Now we have known the basics about tooth whitening. We have to know about extrinsic staining and intrinsic staining. First, extrinsic staining is largely due to environmental factors including smoking, pigments in beverage and foods, antibiotics, and metals such as iron or copper. Colored compounds from these sources are absorbed into acquired dental pellicle or directly onto the surface of the tooth, causing a stain to appear. Now we have to know how to remove extrinsic staining. First way to remove extrinsic staining is through prophylaxis. Dental prophylaxis includes the removal of extrinsic staining using a slow-speed rotary handpiece and a rubber cup with abrasive paste, which contains fluoride, and it can be only done in dental office. The second way to remove extrinsic staining is through toothpaste. Toothpaste, which includes both peroxide as well as abrasive particles such as saliva gel, can rid extrinsic staining, and it could be done in homes too. The third way to remove extrinsic staining is through microabrasion. Microabrasion allows the dental profession to make use of an instrument which emits a powder, water, and compressed air to remove biofilm and extrinsic staining, and it can be only done in office. Now, intrinsic staining. Intrinsic staining is primarily occurs during the tooth development, either before birth or at early childhood. Intrinsic stains are those that cannot be removed through mechanical measures such as debridement or prophylactic stain removal. As the age of the person increases, the teeth can also appear yellow over time. Now, we have known the intrinsic staining and extrinsic staining, and we have to know the methods that are used in office and at homes. First, for the methods that are used in office, before the treatment, the clinician should examine the patient. He or she has to take health and dental history and history of allergies and sensitiveness. And we have to use whitening shade guides. It is used to determine the effectiveness of whitening procedure. And we generally use a light-cured protective layer that is painted on the gums and pupilla. First way to tooth whitening in office is through light accelerated bleaching. Light accelerated bleaching uses power or light energy which is intended to accelerate the process of bleaching in a dental office. Different types of energy can be used in this procedure, with the most common being halogen, LED, or plasma arc. Use of light during bleaching increases the risk of tooth sensitivity and may not be any more effective than bleaching without light when high concentration of hydrogen peroxide are used. But in 2015 study showed that the use of light activator does not improve bleaching. but it is rather likely to increase the temperature of the associated tissues, resulting in damage. So in result, ideal source of energy should be high energy to excite the peroxide molecules without overheating the pulp of the tooth. Second way that are used in office is internal bleaching. It is common. Internal bleaching is a process which occurs after a tooth has been endodontically treated. This means that the tooth will have had the nerve of the tooth aspirated or removed through a root canal treatment at the dentist or by a specialist endodontist. Internal bleaching is often sought after in teeth which have been endodontically treated as tooth discoloration because a tooth problem due to the lack of nerve supply to the tooth. And in case of internal bleaching, it is common to be done on anterior tooth. But internal bleaching has a risk of the internal root resorption of the tooth that has been internally bleached. Now we have to know the methods that can be used in homes. Home tooth whitening products are available from dentists or over-the-counter. At homes, whitening methods include over-the-counter strips and gels, whitening rinses, whitening toothpaste, and tray-based tooth whiteners. First method is through strips and gels. Plastic whitening strips contain a thin layer of peroxide gel, and plastic whitening strips whitening endpoint depend on the frequency of use. And in case of whitening gel, it also contains peroxide. The second way that can be done in homes is through rinses and baking soda. Whitening rinses work by a reaction of the oxygen sources such as hydrogen peroxide. And in case of baking soda, because tooth whitening toothpaste that have excessive obesity are harmful to dental tissues, we can use baking soda as a desirable alternative. Now, we have known the one about intrusive staining, and how to get rid of intrusive staining, and the methods that can be done in homes and office. We have to know the risk of tooth whitening. First is hypersensitivity. Use of bleach with extremely low pH levels may cause the dental tubules to open and the sensitivity will go up. And the sensitivity after whitening treatment can last up to 4 to 39 days. The second risk of tooth whitening is uneven results. Some tooth can be white and some tooth can be still dark. The last risk of tooth whitening is the return to original pre-treatment shade. Nearly half of the change in color may be lost in 7 days. The rebound is experienced when a large portion of the tooth whitening comes from dehydration. So we can know from here that when the teeth get rehydrated, the color will rebound as well. Now we have to know how to maintain tooth whitening. First, we have to brush or flush our mouth with water after eating and drinking. Second, we have to take special care during the first 2 days. Third, we have to drink fluids that may cause staining through a straw. Now for conclusion, we can know about the history of tooth whitening. Ancient Romans used urine with goat milk to tooth whitening. And at the late 17th century, barbers used a file to file down the tooth before applying an acid, which will whiten the tooth. But in this case, it made the teeth very vulnerable. And at 1877, oxalic acid was proposed for tooth whitening. And at the 1920s, mouthwash containing peroxide was found to reduce caries while providing tooth whitening. And at the late 1960s, Dr. William Klossmeyer introduced the custom tray bleaching. Thank you for listening to my presentation about tooth whitening.